Hello and welcome to 6 Minutes. I'm Gemma Collins. This week we feature a special report on telehealth as we find out how a specialist psychiatric practice in Sydney is doing video consultations with patients and GPs in rural areas. Psychiatrists at the Lawson Clinic in Gordon have started taking advantage of the new Medicare rebates for telehealth that the government introduced earlier this month. Using just a webcam and a computer, they are carrying out consultations via Skype with patients who are sitting in their GP surgery hundreds of kilometres away. So how are GPs involved, and are these consultations really benefiting patients? We spoke to one of the clinic's psychiatrists and former GP, Dr Rene de Monchy, to find out more about it.
The number of practices that we probably work with would be about 20, 30 practices. And that can be from a solo practitioner who lives way out on his own to a group practice where 3 or 4 doctors are working together. I usually talk with the doctor or a mental health nurse very briefly first. They've sent in a referral to our practice here, to our clinic, and so that we have an outline already of what the problem is. And then I do the consultation. Usually it's the patient, him or herself, on her own, sometimes with the mental health nurse or the GP there. And then after that hour of initial consultation, then we get together, usually the 3 of us, so the patient, the health practitioner, whoever he is, and myself. I summarize briefly what we've come up with and how we can help to make a management program for the patient. So it's very much like when I was a GP and in an isolated area myself, you often want simply advice. You want advice from a colleague, a specialist, to say, well, Peter, just tell me, am I on the right track, or should I be thinking of something else? What could you add to that? And that's a service that we really do with the telehealth. The patients feel really very happy with that because they are in an isolated area. They can't have the service that they actually would need. So this is an opportunity that they get, and they're very happy for it. I got one patient in the top of Arnhem Land, so it can be anywhere. You could even do it internationally.
Well, we expect to hear a lot more about telehealth as more GPs and specialists take advantage of the new rebates. I'm Gemma Collins. See you next week.